At the beginning of the physical assessment, the nurse will introduce herself and state that she will be performing a head to toe, safe touch exam and tells the patient that if anything feels uncomfortable, please ask her to stop. She IDs the patient by name and date of birth.
Come in.
Hi, Mrs. Smith.
Hi.
How are you doing today?
I'm doing good.
Good. My name is Shannon, and today I'll be your nurse.
Okay.
But the first thing I'm going to start with is your head to toe assessment.
Okay.
So I'll be starting at your head, going to your toes, checking everything in between.
Okay.
And it's called what we call a safe touch exam. So
Okay.
if I touch you in any way that you feel uncomfortable or it hurts, just let me know. And
Okay.
I'll stop, okay? I'm
Okay.
going to identify you. So what's your name and date of birth?
Jane Smith, 11/25/1989.
Great. I'm going to raise your bed up. Working comfortable position for me.
At this time, the nurse will assess the patient's vital signs and also including pain and the level of consciousness of the patient based on person, place, time, and situation.
Okay, Mrs. Smith, are you having any pain on a scale from 0 to 10? With 0 being no pain and 10 being like the most extreme pain?
No, no pain.
No pain? So a 0 out of 10?
Yeah.
Okay. And can you tell me your name?
Jane Smith.
Okay. And what's today's date?
Today is the 2nd of October.
And where are you?
I'm in the hospital.
And why are you here?
I've been having migraine headaches.
Now the nurse will put on her gloves and assess the patient's hair and scalp.
Do hand hygiene. Then I'll put on gloves. Okay. I'm going to adjust something real quick. I'll be right there. Okay. So I'm going to start with your head. I'm just going to check your hair. Have you fallen lately or have any bruises or anything on your head you want me to look at?
No.
Okay. All right. So no pain, no bumps, bruises. Okay.
She will now assess the patient's sinuses.
Okay. So I'm going to touch your sinuses and tell me if there's any pain or pressure.
No.
Okay.
Next, you will assess the conjunctiva.
Okay, I'm going to pull the bottom of your eyelids down.
Okay.
Just tell me,
Okay. Next, the nurse will assess cranial nerve number 1 of the patient by instructing her to smell a strong scented object to check in each nostril.
Okay, I have a secret thing here. I'm going to have you smell it. So I'm going to have you close your eyes and block one nostril and tell me if you know what it is.
That smells like coffee.
You got it. Okay. Okay, can you block the other one? Another thing.
That smells like garlic.
You got it? Okay.
The nurse will now assess cranial nerve number 2 by instructing the patient to look at the Snellen eye chart and asking if the patient wears glasses or has vision problems.
Okay. Mrs. Smith, do you wear contacts or glasses?
No.
So no vision issues?
No.
No new vision issues, like any trouble reading or anything?
No.
Okay, good. Okay, so you're going to take this and you're going to put this over one eye.
Okay.
And you're going to look at the chart on the wall.
Okay.
And you're going to read it for me.
Okay. I see an E.
Okay. I can do to the other eye.
Okay. Yeah, I also see an E.
Okay, good job.
Now the nurse will perform PERLA and assess cranial nerves 3, 4, and 6 with the 6 cardinal fields of gaze.
Okay, Mrs. Smith, I'm going to check your eyes. I'm going to shine this bright light in your eyes just for a second, though.
Okay.
So I'll do each one real quickly. Just look straight ahead. Okay. Now I'm going to have you look at the end of my pen and look at the wall.
Okay.
And then bring your eyes real quick to the top of the pen. I'm going to bring it in.
Okay.
And I'm going to follow it.
Okay.
Here we go. Okay, good job.
Okay.
Now I'm going to have you follow it again. I'm going to check your 8 cardinal gaze. Or 6. Sometimes people do 6, sometimes people do 8. We're going to do 6 today. Okay. All right, so look, just follow this.
Okay.
right, good job.
Next, the nurse will assess cranial nerve number 5 by performing a WIS test. WIS test, where she strokes the forehead, cheeks, and chin and asks the patient to identify where she feels the sensation.
I'm gonna stroke your face somewhere with this. It won't hurt. So close your eyes and then tell me where you feel it.
Okay.
Okay.
My left cheek. Forehead.
Oops, sorry.
Right cheek. And chin.
All right, good job.
To assess cranial nerve number 7, she asks the patient to smile, whistle, raise eyebrows, and frown while checking for symmetry.
All right, I'm gonna ask you a couple things with your face. Okay, so can you smile? How about frown? Okay. How about raise your eyebrows? Okay, how about whistle? I know it's hard sometimes. Oh, good job.
Okay.
I have a hard time with that. Okay.
To check for hearing, she will also check the ears for hearing and assess cranial nerve number 8.
Okay, well you can hear me, right? You have no problem hearing me. Okay. So I'm gonna check your ears inside. Do you wear hearing aids or
No.
no? Any trouble with your hearing?
No.
Okay, so
The nurse can also use a Weber test or Rhine test to assess cranial nerve number 8, and also the Romberg test. She checks cranial nerve 9, 10, and 12 by having the patient perform the swallow test with 1 ounce of water.
okay, Mrs. Smith, there's just a little bit of water in here. Can you swallow that for me?
Okay.
Any trouble?
Mm-mm.
Good. Okay.
She uses the tongue depressor to look for the uvula to rise symmetrically as patient says ah to test gag reflex.
Okay, I'm gonna put this in your mouth. I'm gonna press down on your tongue. I want you to say ah.
Okay.
Okay. You say ah. Okay.
To assess for cranial nerve 12, she has the patient stick out her tongue and move it from side to side.
Can you stick your tongue out and move it? Good job.
At this time, she inspects the mouth and mucous membranes also.
Next, I'm gonna go in your mouth and just check for any. Do you have any sores or anything that's bothering you? No cavities or teeth that hurt?
No.
Dentures?
No.
No, you have your own teeth. Okay. All right. Oh, those look pretty. Okay.
She will now document her findings.
Now I'm gonna check up your nose. I forgot to do that. Okay. Just any problems up there?
Mm-mm.
All right. Document. I'll come right back to you. Okay.
The nurse now moves further down to check the clavicles for breaks.
Okay. Do you have any pain? I'm gonna just check your chest up here.
No.
No pain there.
She palpates the carotid each side one at a time.
Okay, I'm gonna do your carotid arteries over here. Just one at a time.
While in this region, she also palpates the lymph nodes.
Okay, do you have any swollen, like your glands feel swollen or anything? When you swallow? Okay.
To check cranial nerve number 11, she has the patient shrug her shoulders against resistance.
Okay, I'm gonna have you push your shoulders up, like shrug them. Okay, and can you turn your head to the left? Okay, now look to the right.
She now palpates the skin turgor on the sternum.
And I'm gonna touch your chest, okay? Okay,
During the next part of the assessment, the nurse will listen to all 5 heart sounds, beginning with the aortic heart sound.
okay, I'm gonna listen to your heart, okay?
This heart sound is at the second intercostal space to the right of the sternum border.
All right.
The pulmonic heart sound is at the second intercostal space to the left of the sternum border. The third point is the Erb's point, and it's at the third intercostal space to the left of the sternum border.
Okay, talk to me if I'm hurting you. Okay.
The fourth tricuspid heart sound is at the fourth intercostal space to the left of the sternum border.
Okay, I'm gonna can I go up the side of your blouse here or your gown? Okay, so we're gonna go right up. Sorry, we're gonna go like right up in here.
The fifth space, which is called the mitral or apical heart sound, is at the fifth intercostal space, left mid-clavicle line.
Okay, so just
The nurse will now assess the lung sounds for adventation breath sounds.
I'm gonna check, have you had any pain when you're breathing or any trouble or feel short of breath when you exercise, go upstairs?
No.
Alright, I'm gonna listen.
Okay.
There are 10 places on the front and 18 on the back that the nurse will assess.
Okay, so just take a deep breath in. I'm gonna just do 4 on the front and 4 on the back right now. Okay. Okay, I'm gonna have you sit up. Can you take a deep breath? Okay.
Also, while on the patient's back, the nurse will assess any pressure points for signs
Can you
of
sit up
the
for me?
breakdown.
Okay, so you have any pain or anything back here?
No.
No sores. Okay.
The nurse will now use this time to ask the patient about self-breast exams and instructions if needed.
Okay, Mrs. Smith, do you do like monthly self-breast exams? Yeah, do you have any
Once a month.
questions about them or?
Mm-hmm.
Okay, that's a good thing to keep, just doing it monthly. Okay.
The nurse will check each arm for radial pulses and then range of motion and grip strength with push and pulls.
Okay, I'm gonna check your pulses. I'm gonna check your elbows real quick. Okay, those are okay? Okay.
Mhm.
All right. Okay.
The nurse will also use this time to assess the patient's capillary refill on each hand.
Okay. We gotta do your range of motion too. Can you lift your arms? Okay, and out to the, put them down or out to the side. Okay, so no pain.
No.
Okay, so that's good. Okay. I gotta also have you do pushes and pulls. Okay, so can you push? Okay. And pull. And good.
The nurse will now document these findings.
Okay, I'm gonna document that real quick. Okay. Okay.
The nurse will now move on to the abdominal cavity, beginning with an inspection of the area.
I'm gonna put you down. Okay. And to lay flat. And let me know if you're uncomfortable.
Okay.
I'm gonna have to lift your gown and stuff too, so just let me know. Okay. Try not to expose you.
General inspection will include overall skin integrity and distension.
So everything looks good. You don't feel any pressure or anything.
The nurse will auscultate the bowel sounds in all 4 quadrants, beginning with the lower right, then to upper right, then lower left, upper left, and lower left.
Okay, I'm just gonna put this in 4 different places. Okay. I'm just listening for sounds. Well, it's getting close to dinner.
The nurse will next palpate the abdomen.
No pain. Okay. Good. Back
She
down.
now uses this time to ask about last bowel movements.
Okay, Mrs. Smith, when was your last bowel movement?
Yesterday.
Yesterday. Okay. Is that normal for you?
Mm-hmm.
Was everything okay? Good.
This time is also used while in this area to assess the patient's reproductive tract and by asking about last menstrual period and sexual activity.
Okay, Mrs. Smith, when was your last menstrual period?
About 2 weeks ago.
Okay. Was it okay? It's normal,
Normal.
regular. Okay, how about sexual activity? Sexually active?
Yeah, sexually active.
Do you use birth control?
Yes.
Okay. Do you have any questions about that?
No.
Okay. Just let us know if you have any questions.
Okay.
The GU area is also assessed during this time to assess any problems that may occur with bladder function.
Okay, when you urinate, do you have any pain, burning, itching?
No.
No, everything seems to be okay.
Mhm.
Yeah. Okay.
The nurse now will proceed to palpating the pulses, beginning with the femoral pulse.
Okay. So I'm gonna feel your pulses. This one gets a little personal. Okay. So just So I'm gonna do them both at the same time.
Okay.
And I have to kind of push down a little bit, okay? So you can push your gown down. I will. Sorry, okay. So that's it. So. Okay.
Next, you will assess the popliteals.
Try to keep you covered up here. Okay. So these are behind your knees. So you know, these.
After assessing these pulses bilaterally, she moves on to the anterior tibialis.
Okay.
After assessing these, she moves on to the dorsal medialis. The nurse will perform a general inspection for edema on the extremities.
No edema, no swelling. Okay.
And also checking cap refill in both feet.
Okay, I'm gonna do your toes, okay?
The nurse will also perform range of motion at this time.
Can you lift? I'll help you, but you just want to lift your leg up. Okay. Is any pain or anything? How about kind of moving your leg out? Okay. All right. And this one. Okay. Can you like rotate it? Okay.
She asks the patient to point and dorsal flex.
So can you point? Okay. How about like flex your feet? Okay.
While assessing the patient's strength, she also assesses the patient's lower extremities for pressure points.
Okay. So we checked your other stuff. Do you have any? Does it hurt down here, like on your heels or anything? Okay. How about do you have any pain in your calves?
No.
So no pain, like no redness or anything hurting. Okay.
At this point, the physical assessment is complete. The nurse will return the
down.
patient to a comfortable position.
I'm gonna sit you up and just let me know when you're comfortable. I have your call bell here. Oops, the legs are going up. Do you have any questions for me?
No.
Any concerns? Or, that's good.
The nurse will also document the rest of her findings.
All right. Well, Mrs. Smith, if you have any questions, I'll be coming in routinely, and you can ask me. It's nice to meet you.
Nice to meet you too.
Great, thanks.